Good. مرحبا جميعا. أنا Dr. Mohamad Bydon. I'm a neurosurgeon at Mayo Clinic in Rochester, Minnesota. I do have a pre-existing meeting at the top of the hour, and our session was scheduled to end then. And so just out of respect to that engagement, I will have to leave just a minute before the top of the hour. I'll try to move as efficiently as I can, and we'll get through as much of it, and then maybe leave a couple of minutes for questions at the end. I'm a professor in the Department of Neurosurgery, the Department of Orthopedic Surgery, and in Health Services Research. And I've included my email here in case anybody has questions. I do want to acknowledge, we'll talk today about stem cells for spinal cord injury. I do want to acknowledge my colleagues. There's 20 of us who work in this area. My colleagues in physical medicine and rehab, Dr. Chu, Dr. Reeves, Dr. Hunt, Dr. Windebank, Dr. Madigan, Dr. Dietz. And so there is a significant group that works in this. And I'm also fortunate to be the principal investigator of the Mayo Clinic Neuro-Informatics laboratory, which has had a fellow from Jordan in the past. And I've had great luck with wonderful people from the country of Jordan, both collaborating with and working in my laboratory. I'll give you examples of traumatic spinal cord injury. This is a 53-year-old male who sustained a C5 fracture. He's Asia A at the time of surgery, has no ability to move his upper or lower extremities, has a questionable rectal tone, loss of bowel bladder. He undergoes a C2 to 6 decompression and posterior fusion, and subsequently had some improvement, but remained severely and significantly debilitated. And so, actually, let me show you back on this slide. I hope you can see my cursor, but this is the spinal cord here, and you see this large gap right there. That's what occurs in spinal cord injuries, where you see those large gaps in the spinal cord, large areas of myelomalacia, and that's what makes it so difficult to get people to overcome those injuries. The first known medical text to talk about spinal cord injury is from 2500 BC. It's from Egypt. I don't know if there's any Egyptians or people from Masr in the audience, but it's from Egypt, and it's from the Edwin Smith papyrus. It's also the world's oldest surgical text that we know of. And it was written in Egyptian hieroglyphics, and it talks about spinal cord injury. And it says spinal cord injury is an ailment not to be treated because patients don't get better. And so as old as 2500 BC. So fast forward to the early 20th century, so 4,400 years later. And you can see Mixter, anybody who's done surgical training understands well, Mixter in the Annals of Surgery. They used to give it to all the surgical interns. I don't know if that's still the case. Fowler, Bolton. And these surgeons also 4,400 years after the Edwin Smith papyrus also talked about spinal cord injury. And the message was the same. Total lesions, this is Mixter, total lesions of the cord are irredeemable because the cells of the entire thickness of the cord are destroyed, are never regenerated, and are replaced by scar tissue. The lesion thus is permanent and requires no treatment. And that's Mixter from 1904. Spinal cord injury has mechanisms that both include a primary injury and a secondary injury. And within those mechanisms, the primary injury occurs at the time of that initial insult. And that's here. The secondary injury occurs as a result of that initial insult, and the body sending inflammatory signals to the area of the primary injury in order to try to resolve it. And that results in damaged blood vessels, damaged astrocytes, mitochondrial dysfunction, necrosis of the neurons. And that secondary damage is oftentimes what creates so much of the problem in areas of spinal cord injury and what results in difficulty in regeneration. And so clinically for spinal cord injury, we're still providing mostly supportive care to individuals, nursing care, physiotherapy, orthotics, pain management. And many of those things, it's important not to diminish those things because many of those things have resulted in significant improvements for patients in spinal cord injury in terms of quality of life, life expectancy. But there has not been a real paradigm shift in terms of our treatment of these conditions. What is regenerative therapy? And you heard a wonderful talk by Dr. Mamoon on some areas that overlap with individualized medicine, regenerative medicine, and a very impressive one. And so building off of that, regenerative therapy is the process of creating living and functional tissue to repair or replace tissue that's lost due to age, disease, or damage. And so there are cell-based regenerative therapies. There's biomolecular delivery of regenerative treatment options, and then there's scaffold-based or combination-based strategies. So for cellular-based treatment strategies, which is what we'll be discussing today, what is a stem cell? So a stem cell is a cell that's capable of self-renewal, converting to more differentiated cells, proliferating, leading to regeneration of tissues. And you have ectodermal lines, mesodermal lines, and endodermal lines. And those lines result in a variety of tissues that we know in the body today. There's various sources of stem cells, and any of these can be applied to spinal cord injury or to other areas of injury. And so there could be brain sources, spinal cord sources, skin sources, adipose-derived, muscle-derived, bone marrow-derived. So first we started with animal studies, which is where most of this type of work needs to begin. And so you can see Sprague-Dawley rats. We have a control group and a group that we're going to give, in this case, umbilical cord mesenchymal stem cells injected into them. And so in this case, the spinal cord injury can be standardized because it's a imputed injury. And so T9 to T10 spinal cord contusion occurs using the infinite horizon impactor, and that's done after a laminectomy at T9 and 10. And so that's done for both the control and the treatment arm. 7 days after injury, the control arm is given an injection of lactate ringers. The treatment arm is given an injection of umbilical cord mesenchymal stem cells. And then we have weekly behavioral testing by BBB, which is standardized functional scores for rats after spinal cord injury. At 14 weeks, the animals are sacrificed for histology, and then we see the results. So I'll show you some of the functional recovery following umbilical cord mesenchymal stem cell transplantation. And so you see we did, I think now we're up to 12 rats in each group, but we did 6 rats in each group, the control arm and the treatment arm. This is their normal state prior to the spinal cord injury. This is after the induced spinal cord injury, and you can see how low their BBB dropped. And the treatment occurred at this point. And then you can see the improvement that even the control group, which had no injection of stem cells, had some improvement. But the group that had the stem cell injection had much more dramatic improvement. And that improvement was sustained over time. And that improvement grew over time. And so those are the main takeaways from this. And then when we do our histology, we take the spinal cord, harvest it, we slice, and then do H&E stains. And take a look at our control group. Now, this is away from the area of injury. This is the epicenter of the area of injury. And this is essentially a level below the area of injury. And you can see how large the area of myelomalacia is. You can see how large the area of myelomalacia is here, one level away from the injury. And you can see here in the group that received the umbilical cord-derived mesenchymal stem cells, you can look in the epicenter of this group, and you can see the area of spinal cord injury here, how it's much smaller than in the control group that did not receive the cells. You can also see here in the area of the one level away from the area of the spinal cord injury, how again, the group that received the spinal cord, the stem cells, did not have as large of an area of myelomalacia. Now, they both had the same exact primary injury. But the big difference was, the major difference was the secondary response. The secondary response, which, obviously was very different. And I'll show you here, our last sort of animal video. So we collaborate with a group out in California looking at animal studies. And so in this case, these are dogs. These are not induced injuries. These are dogs who were injured in a variety of ways, sometimes a fall, sometimes a car accident, bike versus dog, a variety of different mechanisms. And they get treated with stem cells under a protocol. And so you can see here the dog at the time of his spinal cord injury. You can see after stem cell treatment. Now this is about a year later. His hair is longer, and you can see the dog walking. Now, clearly, there's weakness in the hind legs, but not as bad as what you had seen prior to the treatment. And you see there he's going to do stairs, which are quite difficult, and that'll expose further the weakness in the hind legs. You can see how weak the dog is there. That's a taller step. You see particularly that right leg, which he drags. But he's able to walk much better than he could before, and he makes it up almost to the level of his friends. And so those are, in the interest of time, that's probably where I'll stop, just because we only have 4 minutes left. And I'll open it up to questions. The rest of the story is that we went on to human trials, obviously with U.S. regulatory approval. We've treated 10 patients now, the first patient of which you may have seen as it generated significant interest. And we just got approval a few weeks ago from the Food and Drug Administration in the United States for a phase 2 trial of 40 patients, which we just opened and enrolled our first patient in that trial last week. And so thank you very much. I'll open it up to questions in the remaining few minutes that we have.
Excellent. There is a question from the audience that says, when an injury happens, the nerve cell axons and dendrites are severed, right? How does the specialized stem cells connect in place of old ones?
Right. Yeah. So that's not necessarily what the cells are doing. The cells, there's one component, which is a direct regenerative component. But to get that, my guess is you have to have scaffolds to get that.
Yeah.
Now, remember, these are not total transections of the cord, and these are also blunt injuries, not penetrating injuries, meaning these are not gunshot wounds through the spinal cord. These are blunt injuries, car accidents, surfing accidents, diving accidents, accidents related to activity. And so, or car accidents is the most common. Yeah. And so, we believe the impact of the cells is immunomodulatory, and specifically on that secondary injury component. If you were to completely transect the cord, like to do a bullet a bullet injury through the spinal cord, to me, we haven't treated any like that, and we certainly could, and in future phases hope to. But to me, an injury like that would be one that's more amenable to scaffolds and stem cells. And so and we have a team, one of my collaborators, Dr. Windebank, who that's the primary work that he does, is creating scaffolds for these cells. Yeah. And so that's how I would respond to that. But our primary modality, we believe, is immunomodulatory. I do apologize. It's 10:59 here, and I have another call at 11. Exactly. And just out of respect to the other meeting, I will have to get going. But I want to thank you for inviting me today, and thank you to Dr. Mayo for sharing the session with me.
Thank you so much, Dr. Bydon, and thank you so much, Dr. Maimoun, for your time. It was a great session.